Ayúdame a Vivir is the only nonprofit organization in El Salvador that offers medical treatment for children with cancer at no cost. Guaranteeing comprehensive treatment of the highest medical quality is the most important mission for the organization. Ayúdame a Vivir is also a home, a family, a support system for its patients and relatives. A multidisciplinary team is committed to accompanying patients and families during all stages of the disease. Prior to 1991, there was no specialized medical program, foundation, or entity in El Salvador that treated children with cancer. More than 95% of children diagnosed with cancer died. Ayúdame a Vivir Foundation was born in a post-war period and a devastating earthquake, with the genuine commitment of a small group of people to be able to offer and guarantee access to high-quality medical treatment for all Salvadoran children. These people decided to do something and ended up doing everything. Children have the right to health regardless of their social and economic condition. Ayúdame a Vivir enforces this human right for all children with cancer in El Salvador. There was no model of care, no dedicated infrastructure, no trained staff. Everything had to be done. 2 years were dedicated to raising the necessary funds to start this dream. In 1993, an alliance was initiated with St. Jude Children's Research Hospital for medical consulting, the largest medical treatment and research program for childhood cancer in the world, making El Salvador the first country in the world to join the St. Jude Global Alliance program. In 1994, the legal agreement between St. Jude Children's Research Hospital, Benjamin Bloom National Children's Hospital, and Ayúdame a Vivir Foundation began. Ayúdame a Vivir begins the training of the human resource under the St. Jude Alliance to be able to attend to patients with the right personnel. At the same time, the administrative offices and patient shelter are built on land donated by the Maria Escalón de Núñez Foundation. The work model that was developed in El Salvador has been replicated in more than 69 countries worldwide. El Salvador has been recognized by St. Jude as one of the 4 most cost-efficient countries in the world. Ayúdame a Vivir has achieved great survival results with minimal resources. At the last United Nations Global Meeting, the pediatric cancer program in El Salvador was recognized as a cost-effective regional and global example of care.
Las personas asocian el cáncer con la muerte. No es cierto, porque yo estoy aquí presente ante ustedes.
During the first year, an average of 90 children with leukemia were treated. A year later, medical care was extended to all types of cancer. And since then, an average of 200 new patients per year have been treated. In 2004, we linked our medical data to POND, the Pediatric Oncology Network Database, a scientific network of medical data aimed at improving treatments, sharing strategies, and improving results. In 2008, due to the overcrowding of patients on the 8th floor of the Bloom Hospital, the Ayúdame a Vivir Medical Center was built, a specialized medical center for the treatment of childhood cancer. The medical center was donated by the Rafael Meza Ayau Foundation. This reduced early mortality related to overcrowding and delays due to lack of capacity from 10% to 3%. In 2010, a new stage began with the development of the Safe Chemotherapy Program. The prescription, preparation, and application of oncological drugs are done through a network, having an exhaustive control of the medication applied to each patient, minimizing errors in the compliance of chemotherapies. In 2011, the cytofluorometry laboratory was inaugurated, which allows the diagnosis of leukemia according to international standards with safety, precision, and efficiency. In 2013, the Safe Chemotherapy digital system was expanded to the 8th floor of the Benjamin Bloom National Children's Hospital, increasing the safety of all patients in the program. What does Ayúdame a Vivir do for children with cancer? Not only does it provide first-class treatment, not only does it care for all children who need the medication, but it also advocates nationally and internationally for the rights of the families that are part of the program. It establishes alliances with national organizations that watch over the rights of children and with international expert groups that seek the welfare of children with cancer. In 2017, abandonment to treatment was reduced to less than 1%, as a result of the follow-up and support given to families in a systematic way provided by our psychosocial program. Ayúdame a Vivir has several programs that make the treatment process a close and familiar experience. Palliative care is available for physical pain, with nurses, educators, psycho-oncologists, volunteers, and social workers so that every child suffering from cancer in El Salvador receives comprehensive care. The medical program of Ayúdame a Vivir is becoming more efficient and with better survival statistics. It is necessary to continue optimizing resources to maintain excellence in the care provided to each patient. To date, we have helped all children with cancer who have knocked on our door, but it must always remain open for those who are yet to come. The Pediatric Cancer Program is a national pride and a country project, and all of us together can achieve even more.